So continuing to question 30 of previous NEET PG. So a 24 years female patient gets admitted with drowsiness and irritability. Evaluation showed a calcium level of 14 milligrams per deciliter. Which of the following is more likely to be a cause of condition? So this is also a pretty straightforward question. We know that the normal serum calcium level is 9 to 11 milligrams per deciliter. If possible, try to remember the other units also, like the millimoles value, milliequivalence value. But for more clinical use, at least remember this one. The normal serum calcium level is 9 to 11 milligrams per deciliter. Less than 9 milligrams per deciliter is hypocalcemia. Hypocalcemia is also very important because some conditions like vitamin D deficiency, rickets. So all these will have hypocalcemia. Remember, one important hormone which mediates calcium balance is parathyroid hormone. Calcium metabolism itself is very important because it's not only parathyroid hormone which mediates calcium balance. We have few other things like vitamin D, parathyroid hormone, and we have calcitonin. All these hormones, vitamin D is also considered a hormone. All these have a role in calcium balance. Calcium is taken from diet. Calcium is stored in bones. So in which all places we can mediate calcium balances? One is from the gut. Because we need some mechanisms to absorb calcium from the gut. Another place where calcium metabolism happens is in the kidney. We have some mechanisms to reabsorb excess calcium from the kidney. Calcium is reabsorbed from the distal convoluted tubule. Phosphate is reabsorbed from the proximal convoluted tubule. That is also a basic MCQ. And all the absorbed calcium is deposited in bone. But bone is not a static static organ. It is a dynamic organ because whenever needed, the calcium is absorbed from the bone and is taken into the blood. And whenever in need, excess calcium from the blood is deposited in bone. So bone is basically a dynamic organ of calcium balance. So what does parathyroid hormone do? Parathyroid hormone, it increases calcium in blood. How all calcium can increase in blood? It increases absorption of calcium from the GIT. Hence, blood level of calcium increases. In kidney, how can it increase calcium? By increasing reabsorption of calcium from the distal convoluted tubule. From the distal convoluted tubule of kidney. And how does it increase calcium from the bone? It increases bone resorption. So whenever parathyroid hormone levels increase in the body, the bone gets eroded of its calcium and everything will increase the blood level. So increased blood level of calcium, that is called as hypercalcemia. So for hypercalcemia, parathyroid hormone has to be in excess. The opposite happens when parathyroid hormone is low. Blood calcium will be low, that is called as hypocalcemia. We have another question on that, so we'll discuss it again sometime. How does vitamin D help? Vitamin D is very simple. It is more friendly in the bone, right? That is, it increases calcium from the GIT. In fact, parathyroid hormone acts on the GIT by means of vitamin D only. So vitamin D increases calcium absorption from GIT. That is okay. It increases calcium reabsorption from DCT, okay, but it deposits the calcium in the bone. That is why beyond a particular age, everyone will be given calcium plus vitamin D supplementation. So when vitamin D is deficient, bones will be weak. Okay, remember, when PTH is high, bones will be weak. When vitamin D is low, bones will be weak. Calcitonin is another hormone which deposits calcium in the bone. calcitonin comes as a drug also. So in conditions where bone density is low, we can give calcitonin. So why we came here? Because question is on hypercalcemia. Remember, even if you don't understand every basic of hypercalcemia, there are only two very important causes of hypercalcemia. Which hormone has to be high when calcium has to be high? High parathyroid. So hyperparathyroidism is the most important cause of hypercalcemia. And the second important cause of hypercalcemia is paraneoplastic, means tumors. So how all can tumors cause hypercalcemia? Some tumors like multiple myeloma erodes the bone. There are some cancers like prostate cancer. Prostate is actually osteosclerotic. We have some renal cell tumors, some lung cancers, etc., which deposit. When they metastasize in the bone, they cause lytic lesion. Actually, there was a mnemonic, LYTIC. L is lung, Y can be taken as U. So ureteric tract tumors, testicular tumors, intestinal tumors, colonic tumors. All these are osteolytic, hence the mnemonic lytic. B for B, breast is osteoblastic. And what about prostate? Prostate is both osteoblastic as well as osteolytic. So some clinical clues may come. For example, a patient is having a cough with expectoration, there is clubbing, he is a chronic smoker, he presents with a lytic lung lesion and elevated calcium. So definitely some lung cancer is there. But again, lung cancer is not so easy because we have two types of lung cancers, right? Small cell lung cancer and non-small cell lung cancer. Among non-small cell lung cancer, we have squamous cell carcinoma, adenocarcinoma. Okay, at least remember these two. Remember, small cell carcinoma is a very important MCQ because most of the paraneoplastic, remember, most paraneoplastic manifestation. For example, if a history is given on Cushing syndrome, which tumor causes Cushing syndrome? Small cell carcinoma of the lung. Okay. So most of the paraneoplastic manifestations are due to small cell lung cancer except hypercalcemia, which is a paraneoplastic manifestation of squamous cell lung carcinoma. Okay. So which means the case given is actually hypercalcemia. So if at all an extra clues comes that patient is having a possible lung cancer, the answer has to be squamous cell carcinoma. So how does squamous cell carcinoma cause hypercalcemia? I already told you, when parathyroid hormone is high, calcium will increase. The squamous cell carcinoma of the lung secretes a parathyroid hormone related peptide, PTHRP. It's not PTH, it is PTH related peptide, which causes the same hypercalcemia. Okay, don't get confused. I just wanted to say there are only two basic reasons of hypercalcemia. One is increased parathyroid hormone itself, that is called hyperparathyroidism. Next is paraneoplastic manifestation. Paraneoplastic can be due to some lung bone destroying tumors like multiple myeloma. It can be due to osteolytic secondaries, and for MCQ sake, remember squamous cell carcinoma of the lung, because it secretes parathyroid hormone related peptide which causes hypercalcemia. How does hyperparathyroidism occurs? PTH secreting adenomas or PTH secreting carcinomas or PTH hyperplasia. Even if you don't remember this one, just remember these two causes. Hyperparathyroidism and paraneoplastic are the two important causes of hypercalcemia. So coming back to the question. So patient is a young age female having high calcium level of 14. What is more likely to be the cause of the condition? So hypercalcemia, two causes: hyperparathyroidism due to either adenoma or carcinoma. Second cause is paraneoplastic. So whenever we see this question and think of the option, many of the people will go towards the second option, because many people will recite as squamous cell carcinoma of the lung causes hypercalcemia. But please remember, it's a young age female. They didn't give any other history regarding the lung. So read all the options before answering, right? Parathyroid adenoma causes hyperparathyroidism and it causes hypercalcemia. Okay, adenocarcinoma never causes, squamous cell never causes, of course, small cell cancer never causes. Squamous cell lung carcinoma is also an option, but think of the clinical scenario before you answer. Just a few add-on points. So what are the symptoms of hypercalcemia? You would have heard the groin moan pain disease. So it has generalized bone pain because of bone resorption. You would have heard the famous Brown's tumor in pathology. So there can be abdomen pain in hypercalcemia. Constipation can be there. In CNS there can be irritability. Okay. Suppose if question comes on treatment, the first treatment is hydration. So IV fluids are the main treatment, and we have to make calcium to get excreted. So we discussed in one of the videos, loop diuretics, furosemide or Bartter syndrome, both cause hypercalciuria. So that is one treatment. Then I already told you about calcitonin is a hormone which deposits calcium in the bone. So we can give calcitonin. We can give bisphosphonates. They are drugs which deposit calcium in the bone. So we have many bisphosphonates like zoledronic acid, alendronate, pamidronate, ibadronate, etc. Okay. So in endocrinology, few topics are important, like cortisol is very important. We discussed in one of our previous videos about Addison's, Cushing's and all. So hypercalcemia is also very important. So whenever you have to remember something about hypercalcemia, think of the three important hormones: vitamin D, PTH, at least remember PTH, calcitonin, and important causes of hypercalcemia being hyperparathyroidism, and second cause is malignancy. Of course, there are few other causes. For example, excess vitamin D can cause hypercalcemia, hypervitaminosis D, like toxic doses of vitamin D. There are some conditions like sarcoidosis which secrete vitamin D, but they are rare causes. So at least remember the first two causes.